Which part of the heart's conduction system is going to be found located within this region right here? John here from Med School Boot Camp, and in this video, I'm going to be walking you through this dissection, and we're going to be answering that question. Now, this is a platform called Med School Boot Camp. Specifically, we're in the anatomy question banks, and you can see we use only real high-definition cadaveric images for our question banks, similarly to how you'd be tested in your anatomy labs or in your practical exams. We only use real cadaveric images. You can basically move it around, zoom in and out to get a better visual of the structure that is being targeted or pinned. Now, if you want access to all of these question banks and cadaveric images, you can click the link in our description and create a free account and basically have access to everything on the site. But with that said, let's get back to our question. We're asking which part of the heart's conduction system is found within this region right here. So starting off first, what are we looking at? Well, of course, we're looking at the heart from an anterior perspective. We've cut into our right atrium, as you can see right here, when we've reflected this atrial wall, and we've exposed some of this pectinate muscle right here. This is going to be our superior vena cava, which is going to bring blood back to the heart. This is going to be our inferior vena cava, which is also returning blood back to the heart. This would be our right auricle, found right up here. You can see a lot of that pectinate muscle within there. This back here, this is going to be our fossa ovalis, which is the remnant for the foramen ovale during embryological development. This right here would be the opening for our coronary sinus. And then found down here, this is going to be our tricuspid valve, or the atrioventricular valve, which is going to allow blood to pass from our right atrium into our right ventricle. So the location which we're pointing to is going to be located in the right atrium along this posterior and superior aspect of our right atrium. Which structure is going to be found here? Well, let me pull up my diagram. Now let's walk through the conduction system of the heart. Starting off first, we're going to start at the sinoatrial node, which is going to be found in the right atrium along the superior and posterior aspect of it, found just inferior to our superior vena cava opening. The signal begins here. It's then going to be sent through these internodal fibers to the atrioventricular node, or the AV node, where this signal is then concentrated, and it's going to be sent through the AV bundle, or the bundle of His, before it divides into our right and left bundle of branches, where it's then going to be carried down and give off these Purkinje fibers, which are going to allow that electrical signal to stimulate those myocardiocytes. So if we know that this is the superior posterior aspect of the right atrium, found just inferior to our superior vena cava opening, then this is where we're going to have our sinoatrial node. And from the sinoatrial node, the fibers are then going to be sent to the atrioventricular node, which is then sent down the bundle of His before dividing into the left and right bundle branches and terminating at the Purkinje fibers. So let's lock in our answer choice. And of course, the correct answer is sinoatrial node. Now that's all for this video, but if you want to see more cadaveric dissection breakdowns like this, make sure to subscribe to our YouTube channel. And if you want these question banks, go to bootcamp.com/medschool and create a free account today. I'll see you in the next one.